Hello, and thanks for inviting me. I think my name is Stefanie Witt. I think 2 years ago in Nashville, my colleague Mona was here presenting the project on quality of life and patient-reported outcome measures, and I also think she conducted some interviews, maybe with some of you here, and now I will present what we did with all these information from this interview and why patient-reported outcome measures are so important. So in the first part, I will talk about patient-reported outcomes in general, and then I will present the project Qualify in detail and also invite you to participate so that we can come up with a final product of a questionnaire to assess health-related quality of life. So the first thing is, what is quality of life, what we are talking about? So quality of life is an individual's perception of their position in life in the context of culture, value, regarding goals, standards, and concern. So this is the definition of the World Health Organization. And then we have the construct of health-related quality of life. And this means all these aspects regarding your health status. So, and when we talk about health-related quality of life, it is first of all a subjective construct. So it can only be reported by the patient. Then it's multidimensional, so this means it includes aspects of physical components, of social aspects, of emotional well-being, of treatment, of contact with physicians and clinicians. So it includes many different perspectives that need to be included in such a questionnaire to assess health-related quality of life. And then it's self-assessment, so it can be reported by the patients themselves. It could not be the clinician or someone else, it's the patient who's the only one who can talk about the quality of life. And of course, we include the observer report, so also parents or caregivers give additional information on the quality of life of the patient. So patient-reported outcome measures is what we are talking about when we are researchers, and this means that the patient is the only one who can report about it, and these measures are very important for example, evaluation interventions, for evaluating treatment options, for the use in clinical trials to show up if a treatment is not only effective on the level of clinical outcomes, but also on the level of the individual perception of life. Because health insurance companies, they look at clinical outcomes, but they are also more and more interested in this topic of patient-reported outcomes, and especially when it comes to the topic of reimbursement, they say, yeah, it's good if the clinical outcomes are better, but it's also the same as important that the patients report they feel better, because otherwise, why should they pay for contact lenses, as we heard about? If they are more expensive, then the patient could also use the drops. So that's an important topic. We need this to show up the importance of new treatment options, for example, and it could also help to make better informed decisions on treatment options. So, and then we have different levels on which way we can assess health-related quality of life. We have a generic level. This means that everyone can fill out such a questionnaire and can report about health-related quality of life. So, independently, if you have any kind of disease or if you're healthy, you can use these tools. But these tools are not that good to show treatment effects, because they ask, for example, for children questions like, do you get enough money from your parents? So there will be no change in this topic if you use another treatment, or if your parents have enough time or something like this. So then we have another level, that's a chronic generic level. This can be used to compare different chronic diseases, but these questions are more or less, they're much more sensitive, but not in the way we use it for for showing treatment effects. So then we need the condition-specific level, because these questionnaires assess the health-related quality of life related to a specific condition. And currently there is no tool to assess health-related quality of life in patients with cystinosis. So that's why we came up with the idea to develop such tool that can be used in different contexts. So in general, maybe you know better than me, we have rare chronic diseases impacts the daily life of the individuals on different domains. So there's a treatment, there's social life, there's stigmatization, there are decisions that need to be taken about future. So in many areas, rare chronic disease impacts daily life, and not only the daily life of the individuals affected, but also those life of the caregivers. So it's also important to keep in mind that the caregivers, not only the patients, because they're also suffering from a disease, especially in the first moment when it comes to the diagnosis, and they also have to deal with the treatment in daily life. They also have to deal with who's caring for the child. Sometimes there are financial aspects that are important. So we have to think about the patients, and we have to think about the caregivers, and of course of the siblings. So, and that's why we came up with this project. It's called Development of a Patient-Reported Outcome to Measure the Health-Related Quality of Life of Children, Adolescents, and Young Adults with Cystinosis. In short form, QUALIFY, so it's much more easier. And this project aims to develop such a questionnaire that makes us able to assess the patient's perception of quality of life. And we aimed for a questionnaire in 4 languages. So we want to have this questionnaire usable in the French language, in Spanish, in German, and in English version. And it's in the first step, it's for pediatric patients. So we have included patients from the age of 8 to 26. So we included the young adults because we think it's important to go on. But we got the feedback, especially from the German patient organization and the families, that's not a good idea to stop at the age of 26. So they asked us to go on and include also the adult patients. But for this project so far, we have this group of to the age of 26, and we included also the caregiver of patients from the age from 0 to 26. And this is what we did. So there are some guidelines. If you want to develop a questionnaire, you have to follow these guidelines, that this tool is at the end a valid tool that can be used in clinical trials, for example. So we included, I said, the different age groups, and there need to be a confirmed diagnosis of cystinosis, and we need the informed consent form. All the stuff is approved by an ethical approval board. And then these are the steps we need to conduct to come up with a questionnaire at the end. So the first step, we have to conduct a literature review. We have to find out which tools, which questionnaires are used so far. Maybe there is something, then there's no reason to develop a new one. And then I can tell you there is no tool so far, maybe you know. So that's the reason why we came up with this project. And then the next step, we conducted interviews, focus interviews or focus group interviews with patients and with caregivers to find out about the experiences in daily life with this specific condition. And as you see, we conducted 25 interviews with patients and 51 interviews with caregivers. And based on these interviews, we transcribed them, we wrote them down, and then we analyzed the data to generate items that are based on the quotes from the interviews. So therefore, we used a semi-structured guideline. We ask all patients the same questions to make sure that we cover all aspects that are important. But a semi-structured means there were also space to add some more information if there were other topics from the patient that should be important. And these are the topics we talked about in this in these interviews. So we had questions about daily life, about physical aspects, emotional, as I reported before, the different aspects that are important for quality of life, the different domains. We talked about future and medical care, and especially with the caregivers, we also talked about reaction to diagnosis, because this is an important topic for caregivers. And based on these interviews, we developed the items. So we had different versions for the parents, for the younger ones. We came up with 66 items, and then we had a version for the self-report form for the patients with 88 items, and a form for the young adults. So here you have an example for an item we formulated based on the interviews. And here you see the whole list of topics that are included in the first version, the pilot version, for the questionnaire. And then, yeah, you have here a quote and an example and how we try to stick to the original quote to come up with an item. And the topics that are included are in the physical, so don't be confused, it's not mental, it's physical. Fatigue, muscle pain, photosensitivity, it's about heat, halitosis, odor, so all the topics that are included in the topic of physical aspects. We have the mental aspects, we have aspects of sorrow, anger, self-confidence, how to cope, being different. Then we have the social aspects that are about the contact to peers, feelings of exclusion, about experiences of being bullied, and also communication, how can I communicate about my disease, what should I tell, how can I do it. And then we have the items about the educational sector, so how is it going on in kindergarten, in school, or later on if you are going to start to work or go to university. Everyday life includes aspects of activities, leisure time, and also the topic vacation, as we you know, what do with the treatment, how to cool it, and how to get it on a vacation. And the last big then the topic is medical care. So, yeah, when to take, how to be in contact with physicians, and so on. And the last topic is about future. So. That's also a topic especially for the young adults. What about starting a family, growing up, future worries, sorrows regarding how could life be when I'm older. And then we ask you again, the patient in Germany, Spain, and France, to be like a teacher and use a red pencil and tell us if it's good what we formulated. Are the items fits to the needs, your experiences? And then we got feedback. And then we started to reduce the items, because the first list of items was very long, 66 or 88 items, so it's a very long list. It's not useful in daily life. And then we started to reduce items where the patients or the family said, no, you ask it in another question, or no, that's not that important, you misunderstood something. So then we reduced it, and also we reworded the item, because sometimes we got feedback, please write it in another way, or it's not our language. So then we worked on it again. Then we had the original item and revised it, and here you can see an example from the original item, and the feedback was rewrite it due to glare in everyday life. And then we came up with a new item. We reworded it. And so in the first step in the pilot test, we had a lot of items, and then we reduced it. Some items needs to be dropped from one topic to another, because we got the feedback it fits better to another domain. And we did it in the next step once more, and then we came up with a field and retest version. So this means the questionnaire is shortened and has only 5 domains so far. And this is what we are doing now. We have this shortened questionnaire with all this feedback included that we got from you. And then we ask you for the last time to fill it out, because we need data to analyze it statistically to come up with a validated tool that can be used. And this is what we are doing so far with in this field and retest with these 5 domains. It's an online survey, so you will find later on the QR codes in the presentation, but also outside, because we need more patients to answering the questions. As you can see here, The red lines are all the blocks. We need more patience because we need a sufficient number of participants to be able to analyze the data. So that is why I invite you to participate, or maybe engage your children or whoever you know who fits into this target group to participate. Here for the retest the same. In Germany we have good, we had a good recruitment. I don't know why it worked so well, but we need it also for the other languages. So please take part at the survey. You will find the QR codes here and later on outside, so I will run around. You can ask questions about how it is. It's a shorter version. The first one was very long because we asked for feedback. Now it's just filling out the questionnaire. It takes about 10 minutes to fill out the questionnaire, so it would be great if you can do it. And yeah, if you have some questions, please feel free to come up and then we can talk about, I can tell you some more about this important topic. Thank you.